I'm Dr. Karthika, gynecologist from Vardhan Fertility Centre. Today let's discuss about sleep positions in pregnancy. Up to 3rd and 4th month of pregnancy, your uterus will be inside your pelvic bone and you can sleep in any position during this period of pregnancy. Till 4th and 5th month, you can lie flat or you can turn to right side or left side. And whatever is your preferred position, you can sleep. So beyond 6th and 7th or 8th month of pregnancy, your uterus starts to grow. Once your uterus grow with your good amount of liquor and everything, under your uterus is the major blood vessels coming from the mother's heart, like aorta. It will supply blood flow to the uterus. So if you lie down for a prolonged time in a flat position after 6th or 7th month of pregnancy, there are chances that the blood flow might get reduced. So it is generally recommended to change your positions, avoiding lying flat for prolonged time. So which position is better, right side or left side? So whenever you are consciously alert and awake, it is better to prefer a left lateral position. Why? Because normally, physiologically, when the uterus grows after 7th month, it will take the position towards right. So whenever you want to lie to one side, preferably better you turn to your left side so that the compression to some major blood vessels will get relieved. In other words, it is not that you should lie only on the left side. You can frequently change your position to right side also. And one another common doubt is whether you have to lie to one side before waking up from the bed. There are so many confusions like that. It is not so. Any movement, any change in movement in the bed can be there, but it should not be sudden or abrupt. Like sudden rising up from bed, sudden turning of position should be avoided. Slowly, as in progress, you can turn to either side, but it is not mandatorily required that you should lie down flat, then you have to turn to one side before waking up. It is not so. And one more misconception is that if you change your position frequently, there are chances that baby's umbilical cord will come around the neck. It is not so. Even if you sit quiet for a long time, even if you lie down quiet for a long time, there are chances that umbilical cord might go around the baby's neck. It is not in our control. It is completely depends on the movement of the baby and the position of baby and the water level. Even if you change your position, we cannot prevent the whole looping of cord around the baby. So it is not relatable to your position. In case in scan finding, if you come across the baby's umbilical cord is around the baby's neck, it doesn't mean that you need to do some exercises or some positional variations to correct it or to relieve it. It is not purely in our hand. It is not dependent on our position also.